Hi, Dr. Sasse here from the Continence Center in Nevada. I just wanted to share and discuss a little bit of an interesting research paper which came out recently talking about pregnancy and pelvic floor therapy and pelvic floor rehabilitation. The main concern is that pregnancy is the main risk factor for young females in developing bladder and bowel control problems. More on the bladder side, people develop bladder incontinence or leakage, but surprisingly it also affects the bowel side, and we see this quite a bit where 20 or 25% of women who have some bladder leakage will also have bowel leakage. Most people don't want to talk about the bowel leakage, but it's more aggravating because it really leads to just a worse, more embarrassing, more frustrating problem to contend with. People are very grateful to know that there are solutions out there. So our approach, once the incontinence problem has already set in, is to take a very careful assessment of the person and offer this holistic approach that involves some diet change, some fluid intake change, exercises, pelvic floor therapy, and then the cornerstone for people who really need it is that sacral neuromodulation therapy, which I discuss in other videos, where a little chip device is placed and with some fancy computer technology, a gentle current is applied to switch back on the pelvic floor muscles and nerves and restore that normal sphincter control and emptying of the bowel and bladder. But this article really looked at trying to prevent those problems before they happen. And the study was very well conducted and very clever in that it initiated pelvic floor therapy with some specific exercises to restore the pelvic floor, but use them in a preventive fashion during pregnancy. So this meant that the person was doing not just simple Kegel exercises, but more sophisticated kind of therapy that we would do for someone trying to rehab their pelvic floor. And they were doing this on a preventive basis during pregnancy. And what that often involves is doing exercises that involve squatting, some breathing exercises in conjunction that try to recruit more of the neuromuscular activity of those pelvic floor tissues. And doing this on a regular basis through pregnancy resulted in, you guessed it, a lower rate of development of incontinence after delivery of the baby. So what a nice idea, what a great way to study and show how a preventive measure that was as simple as some exercise therapy could really go a long way toward preventing bowel and bladder incontinence later. And of course, it remains an important tool for us to use later after bowel and bladder incontinence has occurred. If you have this problem and you've been through several rounds of biofeedback therapy and Kegels and pelvic floor exercises and physical therapy, and you don't feel it really solved the problem, of course you're not alone. We think that often the results are helpful, but we know that for many, if not most people, they'll need to go on to a little bit more sophisticated therapy, hence the sacral neuromodulation, which does an amazing job of recruiting and restoring that pelvic floor function. But I thought that the contribution here of a preventive approach with pelvic floor therapy during pregnancy was really an excellent one to add to the medical literature, and something that really ought to be coached and thought of as just an integral part of every pregnancy. Because if we can do simple exercise therapy and prevent these disorders, boy, it sure will improve the quality of life for people after the baby's born, and maybe they can avoid having to go on and have any additional therapies later. So I hope that's been helpful, just sharing that little tidbit of research. We thought that was a nice contribution here, and we've certainly been advocating for that now recently, spreading the word among the providers and doctors and nurses who take care of pregnant patients, and we hope to integrate that into the overall center's mission here in the future. With that, I wish you well, and I wish you great success.